Hello everyone, I am Dr. Aditya from the Shoulder and Knee Clinic, and let's talk about management of rotator cuff disease. So in the previous section we have discussed how the rotator cuff disease can present itself. Now let's talk about the treatment. So when we talk about impingement or tendinitis or inflammation of the rotator cuff, individuals predominantly have pain and a little bit restriction of movement. Typically, majority of these individuals will improve with the trial of physiotherapy. What I expect is by 3 to 4 weeks there should be a 50-60% improvement in the symptoms with physiotherapy, and if that is there, they can continue with doing exercises. What needs to be remembered is exercises should be increased in intensity as you see an improvement in your symptoms, and there should be an increase in the repetitions. Exercises should be continued for at least 3 to 4 months after starting the treatment, because it takes a lot of time to build the muscle. Essentially, exercises for rotator cuff work on improving your shoulder biomechanics, your rotator cuff strength. So if your rotator cuff strength is better, they are able to depress the humeral head better. So the impingement, that is the contact between the acromion and the rotator cuff, decreases, and individuals have an improvement in symptoms. Also, an aspect of long-term treatment is posture correction and workspace ergonomics. So typically individuals should avoid prolonged usage of mobile. They should sit straight while working with a desktop, and preferably they should use a desktop rather than working on a mobile or on the laptop. The elbows should be bent at 90 degrees and the back should be erect when they are working. Now when we look at tears, that's a different treatment option altogether. Tears which are partial can be managed non-operatively initially, and majority of tears where less than 50% of the tendon is torn can be successfully managed non-operatively, having a good result in the long run. However, tears that are more than 50% in thickness of the size of the tendon require a surgical repair. So generally a keyhole surgery or an arthroscopy is done, where the torn tendon is stitched back and repaired to the bone with the help of devices known as anchors. So these anchors are made up of either metal, a biodegradable substance, or hard plastic. So there are three options available in anchors, and typically we prefer biodegradable anchors or biocomposite anchors, as more commonly we call it now. Metal anchors are also good. They are used in bone where the bone quality is poor. It doesn't make a difference whether we use a metal anchor or a biocomposite anchor. The long-term results are the same, and they essentially depend on the quality of the tissue, the number of tendons which have been torn, the duration since the tear, if there is fatty infiltration. So to understand this, we need to look at the rotator cuff as such. So if you see that some individual has torn the rotator cuff, it's not going to heal. It's not going to heal on its own, especially if it's a complete tear. It's like a rubber band. So once it is torn, it retracts. Since it retracts, the muscle doesn't function over a period of time. So gradually the muscular portion is replaced with fat. Once there is significant fatty infiltration or loss of volume of the muscle, then repair tends to yield poorer results compared to doing an acute repair where the results are far better. So that is why post-traumatic or tears which are seen post-injury, especially in young active individuals, are actively repaired, which will lead to faster recovery and better long-term results. Long-standing tears which are more than 3-4 years old, where there is a lot of fatty infiltration, tears in individual above the age of 70 generally tend to have poorer results compared to younger individuals. Since it's an arthroscopy, it can be done as a daycare procedure also. A lot of people are discharged on the same day of the procedure or the next day. There is a stage-wise rehabilitation after a rotator cuff repair. So typically for the first 6 weeks, the arm is kept in a sling. Certain activities are allowed in the front of the body, like typing, writing, eating with a spoon. You can brush your teeth. So these are the things in this plane of the body which are allowed. Lifting your hand away or in the front of the body is not allowed. Typically from 3 weeks we start physiotherapy and the arm is lifted with the help of support, and from 6 weeks unrestricted lifting is started. Typically individuals take around 3 to 4 months to gain the full movement of the shoulder and around 6 months to gain the full strength in the shoulder. It seems like a long recovery, but the important thing we need to understand is there have been a lot of studies which have shown more aggressive rehabilitation protocols, and they have also been associated with higher risk of re-tears. So once the rotator cuff heals, in the long run you have better results. So we stick to a more conservative protocol because yes, initially it may be a bit conservative, but in the long term it gives you a better result. There are two aspects to recovery post a rotator cuff repair. One is getting your movement and strength back, which I have already discussed, and the other aspect is pain relief. So daytime pain which is there typically in a week or two is very minimal, and by 6 weeks generally you don't have any daytime pain. Nighttime pain can take longer time to improve, and typically it takes around 6 weeks to improve. Rotator cuff repair surgery has got very good results, and individuals are able to return to their full form of activity over a period of time. You would have heard about many international cricket athletes, rugby players who would have undergone a rotator cuff surgery and they are back to normal. So these surgeries give very good results in the long run. If you have any questions, if you want to ask anything further about rotator cuff disease, do ping us.